Welcome to CarePod, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kipley Bell, as she interviews different experts along the caregiving journey.
Okay, so I am here with Kathy Neff, who is a patient advocate. So important and timely to have this conversation about patient etiquette, doctor-patient relationships, and etiquette during and around patient care. So important for caregivers to understand protocols and also for doctors to understand why is there a breakdown in clinical relationships. So I brought Kathy on, as many of you know, in the CarePod audience. My dear mentor, Dr. Warren Katz, was one of the early clinicians in life as a child, which just is so amazing and speaks to the testimony of having a powerful doctor-patient relationship and ultimate friendship and respect. So thank you for joining us, Kathy. Welcome to the CarePod.
Thank you for having me. I'm very happy to be here.
Yes. So where I want to begin with this, let me tell you how timely this is, because I had a challenging week in patient care last week around this very topic: patient etiquette, not showing for appointments, taking appointments away from people who really need it. Just the overall disrespect for medicine in general as a noble profession, which I think is a shared responsibility, if you feel me, in that some of my colleagues have created it, and patients have created it. Society has created this kind of rush, this jiffy care, this kind of, you know what I'm saying, breakdown in the ways in which we care for one another. So take me through that. Help me walk through that. First of all, share your journey before we go in. Share your journey of, being a patient and kind of how you came to this place in patient advocacy.
Okay. Well, at 5.5 years old, I was diagnosed with juvenile rheumatoid arthritis, which is where I met Dr. Warren Katz. He was my first doctor, and he's still my doctor / friend / mentor. And so I grew up with arthritis, and back in 1969, it was unheard of to have a child with arthritis, and nobody really knew what to do with me. So that in and of itself was scary for me and scary for my parents. So luckily, we didn't get shuffled around too much at that time because Warren Katz was so great at what he did that he was able to help me immediately. So I'm very grateful for that. And as the years went on and I grew up and had, many, many surgeries, too many to speak of. And I've met so many different doctors, some good, some not so much. But I've learned how to give myself the best care that I could give, becoming my own self-advocate, because today you have to. There's just so much going on in the health field, and doctors are torn between all the work that they have to get done, all the patients they need to see, and giving the best care that each of us deserve to have.
Something you said was so powerful there. You said, I learned to advocate for myself, to give myself the best care possible. That is really profound. What is a good doctor?
A good doctor for me personally is somebody who comes in the room, shakes my hand, looks me in the eye, says, "Hi, Kathy, how are you?" So immediately I become a person and not just the hip or the elbow or the knee in room 5, And so I love that. And then I could tell that they went over the paperwork, that I took the time to fill out for them, as opposed to, "Oh, what are you doing here today?" So when they look at the paperwork, they're like, "You're here because your knee is hurting, whatever the situation is." I feel like they already took time to get to know me. And that really is important. Also, a good doctor is someone who is open to hearing my suggestions, my comments, who understands that I know my body better than he or she, they know being a doctor better than me, but between the two of us, we create a powerful healing partnership together. So a
Love
doctor
it.
who's open to that, yeah, it's a great thing.
And to me, when I hear that, it's like it's a no-brainer.
Right.
It's
Yeah,
a
it is.
no-brainer. But yet it's now something in which we're having to teach. We're having to, create a climate, even in our medical academia, to teach students how to care.
Right.
And it's funny, if you recall, we had that conversation even with Dr. Cass offline, that I've just always been of this mindset: either you care or you don't. You can't
Right.
teach people how to care. But
Right.
Dr. Katz has shared, there is a way in which we can strike a balance, right? To accomplish all the to-dos while making a patient feel seen and heard. So take me through the do's and don'ts as far as the etiquette that you have learned to exercise to get the best care for yourself.
Okay. Well, I've learned that it's important to have your questions prepared before you go in to see the doctor. He doesn't have time for, he or she doesn't have time for you to sit there and be like, wait, what was I going to ask you? What was I supposed to ask you? They don't like that. But they don't mind questions if you're prepared. Excuse me. They also, I've noticed that some doctors don't like questions. They're the
Interesting.
doctor. Yes, they're the doctor, and I'm the patient, and I'm not allowed to talk. And whatever they say is how it goes. So those kind of doctors, I'm like, it's been great to meet you. See you later. And I walk right out of the office because I don't have time for that. I don't agree with that. And because I've been dealing with this arthritis and being a professional patient for 55 plus years now, I feel like I have a lot of experience to know what I'm talking about when it comes to myself. So I don't tolerate a lot of things. And there's a lot of doctors out there. So I don't have to stick with one if it doesn't feel like it's the right thing. So I do ask a lot of questions. If I'm confused, I'm like, I need you to explain that to me again. I'm sorry. The other thing that I've done in the past is if a doctor, let's say I've waited for a doctor for 3 hours, especially a surgeon, that's very common. And he'll come in and he'll be standing there right in front of me, and I'd be like, please take a seat. We have some time together. I waited 3 hours for you and I have questions and I need things explained to me. I'm going into surgery I don't understand and I'm a little scared. So they look at me like, oh, okay, well, that's a first, but okay. And they sit down and we wind up having a really good give and take conversation about what I'm about to go through and any questions, maybe that would come up post-op. So I like a doctor who's willing to work with me. And I think a lot of why we have to teach that today is because there's a combination out there, in my opinion, between like the old school doctors who learned a certain way and the younger generation that's coming in that I think is moldable. You know what I'm saying? Like you might not be able to teach someone how to care, but I think that you can make them aware of whether they're caring or not. And then they then have a choice to care, to learn how to care.
Kathy, that's it. Awareness. That's clutch. Because I guess I have it in my jaded world. Like, hey, if you don't care, if you don't have a heart for people, I can't help you out.
Right, exactly.
But then when you talk about awareness,
Yes.
awareness both of ourselves as clinicians and how we extend pain and see ourselves and our own frailty in the patients we serve,
Right.
and vice versa. I need my patients to see me as human.
Exactly. You are.
I need to eat. I need to go to the bathroom. I need 5 minutes to catch my thoughts, just like you do. You know what I'm saying? And I think that's where a lot of the disconnect does occur in patient care. I want to respect your time. Just as you said, you waited for me. I want to respect the time that you gave me to wait for me, to now give you the time that you deserve in our patient counter. But I also need that reciprocated. So it really is a give and take. So you dropped a few gems here. You said, be prepared, have your questions prepared.
Mhm. And
be
no question is
aware.
a stupid question. Right.
Yes,
No
yes,
question is a stupid question.
yes. You spoke to awareness, which I like. And I like also that you say, hey, doctor, I'm scared about this. I don't know this.
Yes.
This is something you might have seen. If you can take that extra time to break that down for me, that's
Right.
huge as well.
Attention healthcare professionals. Are you looking to enhance your skills and stay ahead in your field? Look no further than our ACCME accredited CME courses. Whether you're a doctor, physician assistant, or nurse practitioner, our courses are tailored to meet your needs. Why focus on geriatric education, you ask? Because regardless of your specialty, geriatric care is becoming increasingly essential. As our population ages, the demand for competent healthcare professionals in geriatrics is higher than ever before. We don't stop there. Our courses also empower caregivers to partner with you in the care of your patients. We believe that by fostering a strong partnership between healthcare clinicians and caregivers, we can provide the best possible care for our elderly population. So join our impactful caregiving community today. Sign up for our ACCME accredited course instruction and take the first step towards advancing your career and making a difference in the lives of your patients.
And then I have to be transparent here now, right? So both Kathy and I have exhibited flexibility, right?
Yes.
We have jumped through many hoops, through
Sure.
Wi-Fi disconnections, all the things to try to make this happen.
Right.
And so
we did it.
And we did it. So we're both here at Starbucks now. So for our listeners who hear background noise, that's what that's about. But it is also an exercise in flexibility, right? So
Yes.
that I would definitely throw in there as a pearl for both patients and doctors alike, to be flexible to get to goal. But sometimes it's not always a straight path.
Exactly.
What else?
That's a really good point.
Yeah.
Well, if I could just say, piggyback on something you said a few seconds ago, which was, I just went to see a doctor just a few days ago. And I was sitting in the waiting room for an hour and a half, and I was getting agitated, and I was having a procedure done. So I was a little anxious, and I hadn't ever had this procedure. So I just wanted it to be over, and I was scared. And sure enough, they finally took me back into the procedure room, and the doctor walked in, and the first thing he said to me is, "I'm so sorry to keep you waiting, Kathy. I just want you to know that I respect you and your time, and it was just simply out of my control today." And I love that. I love that. It
Yes.
made me feel so important, and like he got it. Like I was anxious, I was waiting. It's like I couldn't do anything about my anxiety. So that was one of the first things he said. And those are the kind of doctors that I look for me personally.
Absolutely. To be transparent. Like, I have literally said to patients, I'm not in the back getting my nails done. I respect your time. I will be with you and give you the time that you deserve. And, it's just, or, I need to just grab a quick bite so that I can be fully present with you and not worry about my stomach right now. Just being normal. Kind of putting away the pomp and circumstance, just being human and normal, and saying, hey, you know what? Let me just grab a quick bite so I can be fully present for you and not worry about my stomach right now. And, or I'm just going to take a quick break, I'll be with you, or I ran over, just being a normal human being, not getting caught up in, the formality of the situation.
Exactly. And that's hard to do when you're a patient, because when you go in there, you do have a million questions. You're scared, you're angry, you're in fear. You have all these feelings running through your system. And you walk in and the doctor walks in and you expect him to just cure you. Like right there in that moment, he should fix everything for you. And it doesn't work that way. And a lot of people think that, doctors are like God. And they're not. They're people first and foremost. And that's why your input is so important. My input is so important because I could say something that he never thought of and vice versa.
Absolutely.
So, yeah. So sometimes I'll even ask my doctor if I could tell he's having a really harried kind of day and rushing around trying to get his 50 patients in. I'd be like, how are you today, Dr. Penneberg? And he'll just look at me like dumbfounded. He's like, no patient has ever asked me that. I said, well, you're a person too. So I'd like to know how you're doing. Because if you're doing good, then
you're going to do good.
Yeah, exactly. Exactly.
Absolutely.
So,
absolutely.
These are just tricks that I've learned over the years
Absolutely.
of how to treat the doctor. Treat others the way you want to be treated, right?
Yeah, that's the first rule. Say it all the time.
Yeah,
yes,
exactly.
Yes.
Yeah.
So a couple of things, in the context of caregivers. So when, I've had situations where I've had patients and they have a formal patient advocate through the insurance company that sends somebody in to advocate on their behalf for their patient encounter. But most often, caregivers are the patient advocates.
Yes.
So my biggest tool in that encounter, with a caregiver that wants to pack it all in, that wants to speak for mom, speak for dad, speak for pop, speak for one of my biggest teaching points is to say, I absolutely want to hear everything you have to say as it pertains to Johnny, right? Or Mary. But I want Johnny or Mary to speak for themselves. Even if they have Alzheimer's, even if they have limited cognitive ability, what is their baseline ability to be able to express what their symptoms are? What are your tips for caregivers advocating for their older loved ones in a patient encounter?
Well, definitely to have a good relationship with the doctor as well. And to, you're kind of like the middle person, if you will, and it's so important, especially for older people who don't really remember things, don't know what questions to ask. So the caregiver is not just helping them to the bathroom or making their meals for them, but it's really getting to know what it is they want to know and understand, what scares them, what questions they have, and write all of that down and go over it with them to make sure that the caregiver gets it right before then taking it to the physician. So, and just to have a good relationship, a respectful one, back and forth. It's so important to be heard and to be honored and understood. That in and of itself is so healing.
And I hear a lot of patients, which breaks my heart. A lot of them that I inherit that say, that echo a little bit of what you said earlier. That the doctor said, "Hey, it's my way or the highway," or they didn't want to hear my input, or whatever the case. What do you say to those patients that they don't have many options? Like, let's say their insurance is capitated to that physician or whatever. What are some tools you offer to transform that experience?
Well, I would explain to the doctor what the situation is. You need care. You need it right now. Maybe we got off to a bad start or something. Can we start over? Mm-hmm. And I really need you to help me. And I have no other options right now on the table. So would you please reconsider us starting over and seeing if we can make this work this time? Because you really don't have a lot of options when your insurance is, that way.
Absolutely. Okay, so you do this professionally to corporate entities, and do you do this privately? Tell us about that.
It's mostly private, but I have done some corporate stuff. I actually give talks, motivational talks, and I talk to medical students at UCLA Hospital, and I talk to second, third, and fourth year students and residents.
Awesome.
It was so fun. And I learned more probably than I think they even got from me. But what I really wanted to get the point across to them was, number one, why do you want to be a doctor? Is it for the cars and the money and the women? Or do you really want to help people? And then also, putting on a white coat does not make you a doctor. It just means you're putting on a white coat. So there's so much involved. So you need to have a check-in. Like, why did you choose this career for your life? Is this your passion? Is this your calling? is it again just about the money? Because you know you'll make a lot of money. Because being a doctor, being a physician or a nurse or anything in the medical field, it needs to be a calling in order for you to have the time and the kindness and the patience that
And the tenacity.
patients need. Yes, exactly. And the stamina.
Yeah.
Yeah, that they need. So I had the students come up to me at the end, and there was a couple that said, you know, from your talk, I decided I'm not in this for the right reason, and I'm going to change my major.
Wow.
And I've had other ones that said, well, like I was uncertain and now I'm for sure certain I want to be a doctor based on what you said. So that's very, very gratifying for me. I love speaking in front of people, doctors, students, whatever the case may be, because I do feel like I have a lot to offer based on my experience.
Absolutely.
I've been a professional patient for years. That's my first profession as a professional patient.
Right. And a calling in and of itself, really.
Yeah, it really is.
In and of itself. Yeah. And you know, we just shouted out those characteristics of a doctor, but I think also, right, is humility.
Yes. Very important one. I forgot. Yes.
You know, like when I think about how much I have learned from patients and families and in the care of the patients that I serve and their families,
right? That
those have been the greatest teaching points of my career.
Absolutely.
By and far.
Absolutely.
Yeah.
Right.
And to submit to those who've done it. You know, if I had to offer a pearl to my colleagues, you know, that, wow, now I'm going to be 50 and I'm about 25 years into medicine. So I can offer my own pearls and pitfalls, but I still submit and humble myself to Dr. Katz, for instance, because I revere his journey. Right. So I think that that's an important teaching point as well.
Absolutely. And to be humble too. You know, you kind of know for me within 5 minutes of meeting a doctor if he's all that or thinks he's all that versus he's really in it to help you and wants to hear what you have to say, you know. And and again, it's different like for children, because I think when you're like a pediatrician or something, you need to have way more patience. You know, for kids, they're all over the place and the parents are trying to control them, and you know, and then you have the opposite end of the older people who may even have some dementia or whatever that don't even understand what's going on. So I think patience, like you said, humility, and just, you know, resilience is so important. It's important for the doctor and the patient.
Absolutely.
I think if I were to describe myself in one word, it would be resilient. You've got to have resiliency.
Yeah.
To get well.
Yes.
You know, and you want you want that to be your goal. You don't want to you want the healthcare to be more of a healing care as opposed to healthcare. That's what I call it anyway, healing care.
Healing care. I love it. I love it.
Yeah.
Well, I really thank you for taking the time to join me today and all the hoops that we have both tried to jump through to make this happen. So tell us, how would you like to, if someone wanted to get in touch with you to do a speaking engagement or to, empower their own audience or even private connections, how would you like to connect?
They can email me at Kathy B. Neff. So my full name, Kathy, the letter B like boy, Neff, Neff. @gmail.com. And I'll be happy to reach back out. Yes. Well,
so thank you so much for making this happen. Yes,
and I would love to hear from who's ever interested in hearing more about this. Teach you how to be an advocate, whatever it is you need, I'm here to help you.
Beautiful.
Great information right from the source. For more information on how to caregive like a boss, check out impactfulcaregiving.com. Want to be a guest on the show? Contact us at CarePod@impactfulcaregiving.com.